Hello everyone, this is Rishil Reddy, and in this video I am going to discuss the topic wound and classification of wounds. This video is presented by the MEDeaze and MBBS freaks. First, let us learn what is wound. The definition of wound is given as wound is defined as a break in integrity of skin or tissues which may be associated with disruption of structure and function. After definition, now let us come to know what are the different classification systems of wounds. There are 6 major classification systems of wound. They are rank and Wakefield classification, and other classifications are which are based on type of wound, thickness of the wound, structures involved, time since injury, and finally types of surgical wounds. These are the major 6 classification systems to classify the wounds. Now let us discuss the first major classification, that is rank and Wakefield classification. Rank and Wakefield classification classifies the wounds into two major groups, that is tidy wounds and untidy wounds. Now let us have a brief discussion about the tidy wounds and untidy wounds. Tidy wounds are the wounds which look like surgical incisions, whereas the untidy wounds are caused due to crushing, tearing, burns, and avulsion fractures. In tidy wounds, they are caused due to sharp objects and there is no loss of any tissue. Whereas when we come to untidy wounds, there is excision of tissues, which can be either fracture of bones. In tidy wounds, the major part of healing of wound occur through the primary intention, whereas the wounds of untidy, they get healed by secondary intention. These are the classical differences between tidy wounds and untidy wounds. Now let us come to the second major type of classification of wounds, which is based on type of wound. Based on the type of wound, the wounds are classified as incised wounds, contusions, lacerations, abrasions, stab wounds, traction injuries, and hematoma. Incised wound is defined as a clean cut wound which is due to a sharp objects. Let us see a diagram which describes about the incised wound. The incised wounds has a clean cut margins which is caused due to injury by a sharp objects. Contusion is caused due to blow by a blunt object and damage to the blood vessels which are present underneath the skin. For example, if we take this is a part of our body and damage to any blood vessel underneath the skin leads to formation of hemorrhage underneath the skin. Laceration is an irregular tear of the skin which is caused due to blow by a blunt object. The difference between a lacerated wound and an incised wound is that the incised wound has the clean cut margins, whereas laceration has the irregular margins. When it comes to abrasion, abrasion is a superficial injury which is caused due to shearing of skin. There will be loss of superficial epidermis. Stab is a wound which is caused by a pointed object where the depth of the wound is more than the width of the wound. Traction injuries are seen when the tissues gets displaced from their original anatomical position. Hematoma is the localized collection of blood which is caused due to injury by a blunt object. The major difference between the contusion and hematoma is that contusion is present underneath the skin, whereas hematoma shows a type of swelling due to collection of blood. Here, other type of injuries could be gunshot injuries, injuries to bones, joints, and injuries to nerves and vessels, that is arteries and veins. Now, let's come to the another type of classification which is based on wound thickness. Based on thickness of wound, the wounds are classified as superficial wounds, partial thickness wounds, full thickness, deep wounds, complicated wounds, and finally penetrating wounds. The superficial wounds involve only the epidermis and the layers of dermal papillae, whereas in partial thickness wounds there is involvement of the complete dermis. In full thickness, the dermal appendages are also involved. In deep wounds, there is involvement of complete deep fascia along with the muscles. In complicated wounds, the vessels and nerves are involved. Finally, in penetrating wound, even the visceral organs are also involved in the injury. In the image, we can see that the epidermis, dermis, dermal appendages, deep fascia, muscle are arranged in a proper form. So, the superficial wounds involves only the epidermal layers and the dermal papillae, whereas partial thickness it involves the complete dermis excluding the dermal appendages. In full thickness type of wound, the dermal appendages are also involved, like hair follicle and sebaceous glands, etc. In deep wounds, there is involvement of the deep fascia as well as the muscular tissue. In complicated wounds, the vessels, that is arteries and veins which are present superficially are also involved, including the nerves. In penetrating type of wound, there is involvement of visceral organs also. Now, let us come to the another type of classification which is based on the structures involved in the wound. These are of two major types, that is simple wounds and complex wounds. Simple wounds are defined as the wounds which involve only one organ or tissue, whereas the complex wounds are defined as the injuries which involve multiple organs or tissues. This is another type of classification. Now let us come to the next classification which is based on time since injury, which includes two major classes, acute and chronic. Acute wounds are the type of wounds which show signs of healing of wound within the period of less than 4 weeks, whereas chronic wounds doesn't show any signs of healing even after the time period of more than 4 weeks. This is the major difference between the acute wounds and chronic wounds. And the last type of classification of wounds is the types of surgical wounds. The surgical wounds are grouped as clean wounds, clean contaminated wounds, contaminated wounds, and at last dirty infected wounds. By this, we end up the session about wound and classifications of wounds. Thank you all.